So, hello students. So, today we are going to discuss about muscles of pharynx. Okay. So, there are the two sets of these muscle in the pharynx. Which are those? So, one is a constrictor muscle and another is longitudinal muscle. Constrictor muscle and another is longitudinal muscle. Okay, longitudinal muscle, these are called as also elevator muscle because they place longitudinally. Okay, so which are the constrictor muscle? These are number one is superior constrictor, another is middle constrictor, and the third one is inferior constrictor. Okay, and which are the longitudinal? So one is palatopharyngeus, second is symphyngopharyngeus, and the third one is stylopharyngeus. Okay, so we will see this constrictor muscle and longitudinal muscle one by one. First, we will see this constrictor muscle. These constrictor muscles are they placed in the neck or in the pharyngeal region, just like this flower pot. Take with a narrow base, narrow open base, and they arrange one by one over the other, with opening on the anterior end. Okay, for the opening for this oral cavity, opening for this oral cavity, opening for this laryngeal cavity. How? So this is its flower part like arrangement. This is one over the other. Okay, so this is your superior constrictor, this is middle constrictor, and this is your inferior constrictor. This is have the opening in front. For the cavities. Understand? And they encircle the pharynx, or they form this major bulb in this pharyngeal wall. They are all get originate from this posterior margin of this all this opening. They go backward and inserted on this medial pharyngeal raphe. Okay, so middle pharyngeal raphe is extended from this pharyngeal tubercle to esophagus. Okay, pharyngeal tubercle to esophagus. It is a common insertion of this on the constrictor muscle. Okay, let's see this constrictor muscle, its original insertion in detail. This is the orbit and this is hypomatic arch. Again, this is pharyngeal tubercle. This is styloid process, and this is mastoid process, and this obviously skull. Okay, and here is your upper jaw, and here is your lower jaw. Here is a one process plate that is called as pterygoid plate. And from the pterygoid plate, from the humerus, there is a one ligament is present. That is called as median pterygomandibular raphe. This is called as median pterygomandibular raphe. Pterygomandibular raphe. Okay, and this is its pharyngeal tubercle. Okay, this from the pharyngeal tubercle there is a median raphe. Now see this, there is a bridge bone, hyoid. Okay, below the hyoid bone there is a this thyroid cartilage, and here is the cricoid cartilage, and below here the tracheal vein and the so on. This is hyoid bone, this is thyroid, and this is the cricoid cartilage. Okay. This is styloid process, and if at the styloid process there is a presence of the ligament, that is called as stylohyoid ligament. What is it? This is the stylohyoid ligament. Let's label it. Stylohyoid ligament. Okay. So how does superior constrictor muscle get originate? The superior constrictor muscle get originate from this pterygoid hamulus, pterygomandibular raphe, and the medial portion on the medial side of this mandible, ramus of the mandible, above the mylohyoid line. Okay, so pterygoid hamulus, this is the pterygomandibular raphe, and this is the superior constrictor muscle which is inserted on the pharyngeal tubercle to medial pharyngeal on the medial pharyngeal raphe. Pharyngeal raphe or ligament. Okay. So this is its origin and this is its insertion. What about this middle constrictor? Middle constrictor muscle is originated from this base of the stylohyoid ligament, lesser column, and this upper part of this greater column. Okay, base of this stylohyoid ligament, lesser column, and the upper part of the greater column of this hyoid bone, and it is again inserted on this median pharyngeal raphe. Where it is getting inserted? It is inserted on this median pharyngeal or this fibrous raphe. You call as median fibrous raphe. Okay. What about this third muscle is inferior constrictor. This inferior constrictor muscle is again divided into two parts. Okay. One part is this originated from this thyroid cartilage, and another part is get originated from this cricoid cartilage. The part which is originated from this thyroid cartilage is called the thyropharyngeus muscle, okay, and the part which is get originated from cricoid cartilage is called as cricopharyngeus muscle. Cricopharyngeus muscle. So this thyropharyngeus again you get origin from this oblique line of the thyroid cartilage. Get origin from oblique line of the thyroid cartilage. And cricopharyngeus arises from this again, it's a cricoid cartilage. Okay, so this is thyropharyngeus and this is cricopharyngeus. Okay, so both the thyropharyngeus and this cricopharyngeus they collectively called as inferior constrictor. Okay, so this is one insertion of the superior constrictor inserted on the middle fibrous raphe. This is the middle constrictor again inserted on this middle fibrous raphe, and this is the inferior constrictor which is again get inserted on the median fibrous raphe. Okay, means this is all this muscle having this common insertion. Okay, so all this muscle, what is the importance or what is the functions of this muscle? So these muscles help in this deglutition. These muscles, both superior constrictor, middle constrictor and inferior constrictor, this help in this deglutition. Okay, so this is the functions of this superior constrictor muscle. Okay. Okay, let's see this importance of this thyropharyngeus and cricopharyngeus. So this is the inferior constrictor muscle. Okay, it is having this oblique Hyropharyngeus muscle. Okay, and the transversely placed cricopharyngeus muscle. Okay, in between space there is a gap. This is a gap is called as pharyngeal tubercle or this Killian dehiscence. That is called as Killian dehiscence. Okay, and from the Killian dehiscence, this mucosa and the submucosa they get comes out or the bulge. This is called as the pharyngeal pouch or you may call it as the Jenker's diverticula. This is called as Jenker's diverticula. Jenker's diverticula. Okay, so this is about your Killian dehiscence. One more important feature that this muscle having this gap. The potential gap in between this muscle, that is the gap between the base of the skull and the superior constrictor, in between the superior constrictor and the inferior constrictor, in between the middle constrictor and middle constrictor to inferior constrictor. So the some structure pass in between this gap. Okay, let's see the V structure pass in this V structure pass in the gap between this pharyngeal wall. This is the base of this skull. Okay, this is medial part. This is your superior constrictor, middle constrictor, and this inferior constrictor. Superior constrictor, middle constrictor, and this inferior constrictor. Okay. Base of this skull. Okay. So which structure passing between this base of this skull and this superior constrictor? So first one is your auditory tube. First one is your auditory tube. Okay. The muscle attached to it, that is the levator palatine muscle. Okay. Muscle attached to is levator palatine muscle. Okay. And the two arteries, ascending palatine artery and the palatine branch of ascending pharyngeal artery. Ascending pharyngeal artery and the palatine branch of ascending pharyngeal artery. These two structures passes, these four structures passes in between this base of this skull and superior constrictor. Okay, which are the structures are passing between the superior constrictor and middle constrictor? There is important is the stylohyoid ligament, stylopharyngeus muscle, and nerve supplying to it, that is the glossopharyngeal nerve. Stylopharyngeus muscle and glossopharyngeal nerve. Okay. Then the middle and inferior constrictor, which structure passing through it? There superior laryngeal artery, which is a branch of superior thyroid artery, and internal laryngeal nerve. Internal laryngeal nerve. Okay. And this is the inferior constrictor, in between inferior constrictor and the esophagus. So which are the structure passing through it? The inferior laryngeal artery, which is a branch of inferior thyroid artery, and recurrent laryngeal nerve. So these are the structure passing through this potential gap between these muscles, between the base of the muscle and superior constrictor, auditory tube, levator palatine muscle, okay, and this ascending palatine artery and the palatine branch of the ascending pharyngeal artery. Superior and middle constrictor, stylopharyngeus muscle, and this palatine nerve. Middle constrictor, superior laryngeal artery and inferior laryngeal nerve, and between the inferior constrictor and this esophagus, inferior laryngeal artery and the recurrent laryngeal nerve. Okay, that is again another importance of this potential gap presenting between this pharyngeal wall. Okay, or in between the muscle of the superior constrictor. Okay, now we will see this longitudinal muscle. So, three, as you already know, there are the three longitudinal muscles. This is the palate, okay, and here is the liver. thyroid cartilage. Okay. So the first muscle get attached is, that is a palatopharyngeus, which is arranged by these two fascicula and get inserted on the posterior border of this thyroid cartilage. Okay. Then another is salpingopharyngeus, which is get originated from auditory tube, base of the auditory tube, or cartilaginous part of the auditory tube. Okay. And this is get again inserted on posterior wall of the thyroid cartilage. Okay. And the third one is arranged from this talus, base of the talus, and again get inserted on this posterior wall of the thyroid cartilage. Okay. So this muscle is called as palatopharyngeus, this is the salpingopharyngeus, and this is the stylopharyngeus. Okay. This is two fascicula. Okay. Origin of the palatopharyngeus, stylopharyngeus from this cartilaginous part of the auditory tube, and from the base of the talus, the stylopharyngeus. All this muscle goes on this inserted out. So this is the cartilage. Imagine this is the thyroid cartilage, and it is inserted on. This is the posterior border. So this is inserted on this posterior border. That is the palatopharyngeus, salpingopharyngeus, and this stylopharyngeus. Okay. So these are this origin and insertion of longitudinal muscles. So what is the importance, or what is the action of these? What is the action of the longitudinal muscles? Okay. So as the name indicates, they are longitudinal muscles. These are called as elevator. These are called as elevator muscles. Okay. So they help in this elevate larynx and they shorten these pores of the pharynx during the swallowing of this deglutition. It elevates larynx during this swallowing process. Okay. So that is the functions or the action of this longitudinal muscle. Okay. You know what is the nerve supply of this muscle? So all this muscle or the muscle of the pharynx are supplied by this cranial root of this accessory nerve. Cranial root of accessory nerve. Okay. Through pharyngeal branch of the vagus and the pharyngeal plexus. Okay. So that is the nerve supply of all these muscles, except talopharyngeus, which is supplied by this glossopharyngeal nerve. Okay. So this is the nerve supply of the pharyngeal muscle. Okay. I hope you understand this topic very well. So let's revise in brief. The muscle of the pharynx. In muscle of the pharynx, there are the two sets of the muscle: constrictor muscle and longitudinal muscle. Which are the constrictor muscle? Superior constrictor, middle constrictor, and inferior constrictor. Okay. And longitudinal muscle: palatopharyngeus, stylopharyngeus, and the salpingopharyngeus. These are the origin from the typical dehameral thoracomandibular raphe and inserted on the medial fibrous raphe. Okay. Then this is again medial constrictor. This is arrived from the hyoid bone, and this thyropharyngeus and the picopharyngeus. And these collectively called as inferior constrictor, which is again inserted on this medial fibrous raphe. Okay. The space between this thyropharyngeus and picopharyngeus is called as iliac dehiscence, and this pouch diverticulate of the mucosa and submucosa, that is called as Zenker's diverticulum. Okay. Then these three muscles: palatopharyngeus from the palate, okay, salpingopharyngeus from this cartilaginous part of the auditory tube, and the stylopharyngeus from the base of the stylet process, and these are all inserted into posterior border of this thyroid cartilage. Okay. So all these muscles are the muscle help in this deglutition process, and the longitudinal muscle help in this elevation of this larynx during the process of this swallowing. Okay. Then what is the nerve supply? So all the muscles of the muscle of the pharynx are supplied by the cranial root of the accessory nerve through the pharyngeal branch of the vagus and the pharyngeal plexus. Okay, except stylopharyngeus, which is supplied by this glossopharyngeal nerve. Okay, I hope you understand the topic very well. Okay. If you have any queries, please feel free to ask me. Okay, thank you.